Thank you, Dr. Nishad and Kulun Singh, sir. Good evening, good afternoon, and good morning. This is the 1638th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. HUBERT de Silva. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have an international session in English. And from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends as well as homeopathic lovers. The purpose of this forum is to take homeopathy to every household around the world and connecting between doctors around the world. And let me come to today's guest. As you all know, Dr. HUBERT de Silva is a person who is always here whenever there is a crisis situation as far as the international forum is concerned, because we have another person supposed to take the session, but due to some family problems, she was not able to come to the floor as her mother is not in the well. That's the reason. So Dr. HUBERT is always prepared himself for presenting any session. And today, as you all know, that he is our steering committee member. He is the person who is uploading all videos, and he is the person who is undertaking publication of magazines from International Forum for Promoting Homeopathy, and he has completed BHMS, and he has another post-graduation in M.Sc in psychology and all those things, and he's running a clinic also at Trivandrum, the capital city of Kerala, and doing excellent job in treating patients with homeopathic medicine. And he has taken lot of session in this forum. And today, Dr. HUBERT will be taking a session, a different session, that is speaking about endocardiology and management of diseases from endocrinology, and whatever may be. So let us proudly welcome the guest of the day, Dr. HUBERT, to this session.
Thank you, Dr. Danesh, for nice words. Can you hear me?
Yes, everything fine.
Thank you all. Today at 5 o'clock, Dr. Danesh called me to say that all these things. And after that, I prepared the slides and started. So thank you all. Today, let me share my. Can you see this?
Yes. You can make it big screen.
Thank you. Now let us go to the wording from scriptures. Says that. Likewise, James 3:5. Likewise, the tongue is a small part of the body, but it makes great boast. Consider what a great forest is set on fire by a small spark. The tongue is also a fire, a world of evil among the parts of the body. It corrupts the whole person, set the whole course of his life on fire, and is itself set on fire by hell. That means, likewise, the tongue, we are talking about our tongue, is a small part of the body, a very small part of the body. But it makes great boast. It can boast anything. One can say anything. big words. Even though he is a small person, he is not able to do anything, but he can boast like a great man, like Alexander the Great. And consider what a great forest is set on fire by a small spark. We know that a small spark, a fire, a spark of a fire can consume a whole forest. Likewise, the tongue is also a fire. Tongue is a fire. A world of evil among the parts of the body. Sometimes it makes good things. We can use it for good purpose as well as in bad purposes, we can say. We can use our tongue. It corrupts the whole person. If I remember one thing. I have a good musician. I liked him very much. One great personality of a musician, a good musician in Malayalam. One day, he ridiculed one of a contestant. He made a body shaming. That time, I hate him. I hated forever that person. Because that person only he made a black remark on a person. He's not good looking, but he insulted him. That the same word made me a great hatred in me that he's not a good person. So that's much important that our tongue should be used for. If our tongue is perfect, I am a perfect man. If our tongue is not good, so it corrupts the whole person, set the whole course of his life on fire. We know that all the things all around our world, there are from words that come in all these evil things. We know that Mahabharata Yuddha, the war of Mahabharata, caused by a word. There are so many wars and calamities through words. So we all should keep our tongue clean. That is why today our subject is not, I am talking about endocrinology, how it affects the tongue. And the tongue is a source. We can see through tongue, we can see what are the problems are facing human beings. So let us go. All things are coming out, isn't it? One minute. Just a minute.
Please reshare.
We can see tongue, how the tongue is affected. These are the places where the different parts of the tongue we can feel. Sweet we can feel here. If we put some sweet here, it won't. We won't get the sweetness. Salt, this lateral area of the tongue. Sour, here. Back, posterior part of tongue. And bitter taste is feeling the back of the tongue. Hormones produced in the tongue and other parts of the body affect taste, oral health, appetite, taste. Hormones in taste buds. Hormones like cholecystokinin, glucagon like peptide 1, and neuropeptide are produced in taste buds and may affect appetite and food choices. Tongue produces these hormones. Again, we can go to the hormones produced in the tongue and other parts of the body affect taste, oral health, and appetite, taste, hormones in taste buds, hormones like polycytokinin, glucagon like peptide 1, and neuropeptide Y are produced in taste buds and may affect appetite and food choices. Many times we may be astonished while we are giving homeopathic medicines, how it is affecting, how speedily it is affecting. If one person once taken ganja, and he was laughing like anything. That time I put 3 drops of Nexomica. Immediately he stopped his laughing and cooled down. So whenever we are taking, if many of the doctors may have experiences of giving chamomilla for persons, small child, while they are crying bitterly, that time we are giving a few drops of chamomilla, it may immediately stop the crying of the child. Here, what is happening? We know that these are the hormones. We already we studied these are the hormones. We know it, but there may be many. Tongue is a great thing. If one is tasteless, his life is gone. Even if very nice food, he cannot taste. He is not getting the taste of that food. What will be his life? Tasting. Our eyes, our tongue are absorbing all the things in the world. So it is very much important. Our tongue should be clean, and we must give much importance to it. While as a doctor, we know that whenever a patient comes to our hospital, we have to check his tongue. Tongue will give us many informations. We know that there are so many medicines we are using for tongue after getting the symptoms. We know that anti-improved, Betstros, Belladonna, Aconite, Nexomica. These are the medicine very immediately they affect. Arnica. These are the medicine very much immediately affect our body. The whole body will be. I got once I took my extracted one teeth. That time I taken a chocolate and immediately it went to that place. And I was very much had a pain, severe pain. That time I took one tablet, the allopathic doctor given me, and I took that tablet. But it did not work. But I took Arnica 30 on dose. Immediately that pain gone. That much where effective of medicine is. There is geographic tongue. Typical geographic tongue, atypical geographic tongue. For clinical diagnosis, we have to do blood test, blood count, iron, glucose, and cytological studies, negative, biopsy, early diagnosis, systemic diagnosis, oral diagnosis, the oral diseases. Systemic diseases, we know that there are so many systemic diseases, psoriasis, anxiety, allergies, anemia, diabetes, celiac disorders. And at the same time, oral diseases like candidiasis, caries, twisted tongue, caries of teeth, we know that. Inform the person his lesion is a benign behavior. There are benign behavior as well as there are malignant disorders. Once a person came to my clinic, a lady, she is always telling lies. She told me that she's having some, her tongue having some, she had a bite and her tongue is having some pain. So give me some medicine. I asked her to show her tongue, but she did not show me. And she again told me that, give me medicine, give me medicine, give me medicine. Many times she repeated, but she did not take she did not show me her tongue. But I was forced her to take, I want to ask her, show me the tongue. Last time she showed me her tongue. I saw that there is a carcinoma of the tongue, a growth. She told me lies. So she hid me from seeing that. I asked her, I told her that this is a cancer. What? That time I am not confident enough to treat patients like cancer patients. She told me that, give me medicine. I went there and I went to cancer center and they told me that to remove her tongue, a part of the tongue. But after seeing all these things, after knowing all the things, she came to me and told me lies that there is only a simple bite. But I sent her. But she asked me, she told me that, doctor, you give me medicine, you give me medicine. If I go there, they will take my tongue. That time I had given her some medicine. And within 2 weeks, her pain all gone. But I was not confident enough to continue that treatment. I sent her again to Regional Cancer Center. But I knew that after 1.5 years, she had gone. So tongue is an important part of our body. Let us go to what hormone caused bad breath, foul breath. We have medicines. We have arsenic alba, very severe tongue disorders, Mersol. This is due to the stress hormone called cortisol, adrenaline, and noradrenaline. Together, this hormone can change the production of the bacteria, making your breath smell bad. What are the hormones? Cortisol, stress hormones like cortisol, adrenaline, and noradrenaline. Together, these hormones can change the production of bacteria, making your breath smell bad. We know that there are some reasons for foul breath of the mouth. These are some hormonal reasons. And other causative factors are some, if one had taken some meat or something like meat or anything like fish or something like that, if it is inside the, between the teeth, sometimes it may take years. It may stay there for years, and it may cause for bad, more foul breath. So we have to check that the teeth and inside the between it, if there is any additions there, we have to remove it. Any remnants of the this type of things or food materials, we have to remove. Then that time the foul breath may go. And now these are the hormones: cortisol, adrenaline. These are the we just think about it. Stress hormone, like stress hormone. Stress may produce foul breath. These are the areas where lungs, tongue may affect. We can see that heart is the forefront area. Having tongue may have if we are taking some medicines, tip of the tongue, it may immediately affect the heart. It may reach heart. The impulses which reach heart. Just back, lungs. Again back, stomach, heart, the front part of our body, forefront. After that, stomach, lungs. We know that our body, both part, lungs, just behind, and that stomach, back, behind the lungs and heart, and then pancreas, and again the lateral part, the medial part, pancreas, and the lateral part, liver, gallbladder, spleen, both sides, and intestine, lower part of our abdomen, and the behind the under the chest, then bladder, right kidney, here right kidney and left kidney. It is from we can study which are the parts. If we are giving medicines to that part, we can make some beneficial for the patient. Touch some medicines of the heart, medicines of the tip of the tongue, were sweet. Again, stomach, lungs, lung medicines, the lateral part of the tongue, both the lateral part of the tongue, liver, gallbladder, and spleen. Here, then we have to keep it in mind that coming from front to the back, from upper to the lower part of our body. Even if we taste a small sweet or a chocolate, how happy will be our mind will be happy. We will get just energy. And if we are taking some glucose of the tongue, we get immediately we get an energy. So these are how this is our body is planning, how God created. I wonder how how greatly He created all these things. Atheists, fools are called that fools. Ethics are fools because they cannot even see all these things, these wonderful things of God's creation. How beautifully God created everything. So the great scientist is, the first scientist is God. He created all these things. We are always studying and learning from Him. Thank you. Adrenal cortical hormones. Hydrocortisone and other adrenal cortical hormones affect taste acuity, sharpness, and keenness. Acuity means sharpness and keenness. Adrenal cortical hormones, hydrocortisone, and other adrenal cortical hormones affect taste acuity. We cannot distinguish which taste. What taste? Is it bitterness? Is it sweet? So these hydrocortisones and other adrenal cortical hormones affect taste acuity, keenness. We can't understand which taste this is. Tastelessness. Thyroid, parathyroid, and pituitary hormones. Deficiencies in these hormones can cause taste problems. So we had to treat taste problems. Hormones, hormone therapy we had to do. Which are the hormone medicines we have? There are so many hormone medicines, and there are so many medicines immediately affecting. Acute medicines are there, chronic medicines are there, natrum more are there, natrum force, natrum more, calcarea carb, nexomica, even the female aconite and other zinc. A zinc deficiency can cause taste buds to die. We learned first that taste buds are producing hormones. If the taste buds are dead, we won't get the taste, leading to a loss of taste. Thank God. Loss of taste. Zinc. We have medicines. Which are the medicines we are having? Zinc, Zingamet, metallic zinc itself we use. There are so many other medicines, zinc group medicines are there. So zinc is an important medicine for tastelessness. And we can use Oramet. Metallic medicines. Even we can use Ferramphos. Sometimes I want some sort of irritation of the skin irritations, itchy. We have to treat with Ferramet and Ferramphos. Because itching may go. If we make a good blood, the itching may go. Which are the medicine? Ferramphos and Ferramet, arsenic album. At the same time, if we are using arsenic album, immediately the blood count will increase. The HbA1 will be increased. It may produce whatever, I don't know, but it may give a good result. Arsenic album, Ferramet, and Ferramphos for anemia. And if we are treating for anemia, that time the skin, sometimes the allergic of skin may be healed. I have many experiences, so you can use, at the same time, we can use other medicines like sulfur. For dermography, we can use sulfur serum. Very small dose. On tablet is enough. Unmedicated globule is enough. At the same time, we can use the Syrubatry also. I give, at the same time, I give sulfur serum and Syrubatry in a single packet. Both sides will affect. Internal, the most internal part to external part it may affect. Sulfur serum on tablet, on globule is enough. On globule and 2-3 pellets of sulfur Syrubatry. Dermography, for several years, we know that dermography, if we are scratching, it may immediately the inflammation and the skin will raise. That type of cases, we can use it. Can hormones affect the tongue? As the oral mucosa contains estrogen receptors, variation in hormone levels directly affect the oral cavity. The principal peri and post-menopausal oral symptoms are xerostomia, sensation of painful mouth, of numerous causes, and burning mouth syndrome. Can hormones affect the tongue? Affect the tongue. As the oral mucosa contains estrogen receptors, variations in hormone levels directly affect the oral cavity. The principal peri and postmenopausal oral symptoms are xerostomia, sensation of painful mouth, of numerous causes, and burning mouth syndrome. For burning, we know that Graphitis and laxasis are two medicines we are using in the postmenopausal oral symptoms. At the same time, we can use acid night, Mersol, mercaptan. Which are the medicines? Mersol, mercaptan, acid night, Acid force also can be used. Acid night is more useful and mercurius. Mersol, all syphilitic compliance medicines, we can use the syphilinum. You can use. We can use for that for acute, to manage the acute conditions. We can use painful effects. We can use bell, arnica, maxos. These are the three medicines I am using for acute problems. Acute management, for acute management, stomatitis and different types of tongues. You see, I think that this, I got this picture from net. So I think that this written, this Chinese, there are some classifications in Chinese medicine, different types of tongue. Oral health. Hormones during puberty, estrogen and progesterone can increase blood flow to the gum, making them more likely to bleed and swell. Sometimes we know that in the later ages, gingivitis, gums may bleed, gum bleed, phosphorus. Phosphorus is an important medicine for gum bleeding. Hormonal changes during menopause. Menopausal women may experience dry mouth, altered taste, and burning sensation, vitamin and mineral deficiencies, low iron and reduced B vitamins can contribute to burning mouth syndrome. During the time of menopausal period, hormonal changes may, women may experience dry mouth. Dry mouth may be due to diabetes also, altered taste and burning sensation, vitamin and mineral deficiencies, low iron and reduced vitamins, B complex vitamins can contribute to burning mouth syndrome. Burning mouth syndrome, BMS, short form is BMS, may be affected with. These are the reasons, one of the many reasons. Burning tongue, common symptoms, dry mouth, sore throat, itchy mouth, sticky mouth, a tingling or numb sensation in the mouth or on the tip of the tongue, a metallic taste. Again, burning tongue, common symptoms are dry mouth, sore mouth, itchy mouth, sticky mouth, a tingling or numb sensation in the mouth or on the tip of the tongue, a metallic taste. One person on years back on came. He went so many hospitals, allopathic hospitals, and the doctors afraid to attend him because his tongue having different type of taste. Immediately, one after another, sweet taste, so, salty taste, bitter taste, and the doctors don't know how they can manage. The allopathy doctors, many, he went to medical colleges and other many reputed hospitals here. At last, he came to me. But his pressure was always between 140 to 200. I had given him, I normally I used to reduce BP. I normally do treatment I do for blood vessels. I won't give medicines like Revolver for persons. Sometimes we may give for 1 or 2 doses. I won't, otherwise I won't give. I had treated that case with, and I gave him natron sulf as well as the other medicines I used, Spigidia, cactus, carbobage, and cider, and calcareous flow. These are the medicines I am normally using for BP and all other complaints of blood vessel diseases. I told in many situations, I told this, events I told this to you. And after that, his BP came down and his taste, different types of, alternating types of taste, all gone. He became normal. And he came after some time, after years back, he came to me and again I had given that medicine that it's a rock healed. So these are, I am again and again saying that we are managing a case. How to manage a case? We sometimes we don't know what to do in cases like this. Here and then, taste changing for, even for minutes, it is changing. Sweet to bad, bitter, bitter to salty, salt to burning, that type of changes. I treated for to do what is we have to do for the normal living. That time these symptoms will go. Then here come, what are the symptoms of a weak tongue? Symptoms of hypoglossal nerve disorders. Other areas, nerves. The tongue becomes weak on the affected side and eventually wastes away, atrophies. Tongue may shrink. As a result, people have difficulty speaking, chewing, and swallowing. This is neural disorder. Hormones may affect nervous disease. It may affect the nervous system. The tongue became weak on the affected side and eventually wastes away, atrophies. Atrophies, we know that atrophy. Atrophies, as a result, people have difficulty in speaking, chewing, and swallowing. Slurred talking. So we have getting information from patients when they are speaking, the clarity of the language may be one of the reasons. I want to say another thing. We know that some film actors in Malayalam, like Prithviraj, he talks very clearly. Some persons are talking very clearly, like Amitabh Bachchan, Rajinikanth, great personalities. They are talking very clearly. Why they are talking very clearly? They are pronouncing very clearly. They are talking very beautiful construction of words. How getting this, all these things? We know that they are from very good, I say that. They are, we call it them good families, they are family background. They are from literal, they are from great poets. And from that family they are coming. They are giving, if somebody can say, I heard on small story that on child at on examiner came to a class, a small class, told him to say 1, 2, 3, 4, 5, 6. He told that 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That time he asked the teacher, what this child is saying like this? 1 to 5 it is okay, 1, 2, 3, 4, 5 is okay. From 5 to 10, 6, 7, 8, 9, 10. Why? He was taught by 1 to 5, her mother taught her. From 5 to 10, her grandmother taught her. That is why that's sluggish talking. So we have to give clear from the childhood. We have to take good. We should correct the pronunciation. Then only they will have a good pronunciation, and the talk will be very much interesting, and it will be beautiful for others to very attractively they can speak. So it should be in the child itself. Don't think that it may come in. We know that the pronunciations are now changing. In our childhood, we say that direction, director. Now, director, direction. What is the difference? I am always still. Now, I am using the same pronunciation, director and direction. Because English came from English person, British. American English says that direction. Direction. That is British English. Now, Indian English is another classification came. Now, there are 3 types of English. When we are going to the Google, we can see that there are 3 types of English. That is British English, American English, and Indian English. Which one we follow? A Hindi person should follow Hindi. A English person, English, while we are talking English, we have to follow English persons. So, tongue, sluggish speech. When we are taking the case, we know that clarity of speaking, the pronunciation differences. That time we should think about these conditions. We may go in different time while we are taking patients. We may see these are the affected areas, why this is causing for the difficulty in speaking. So here we have to study them carefully, because if it's given from it is from his childhood, or it is came after that his adult age. The sluggishness of speech and difficulty in speech and chewing, following, these are difficulties we feel that time. We can see that we have to study it from his childhood or in the adult stage, or it is developing nowadays. Mapped tongue. There are several types of tongues. Now most of the doctors may think that this is this medicine. Immediately it will come to our mind. We have to take it carefully. Can low estrogen cause burning tongue? Who is most at risk for burning mouth syndrome? I told you, burning mouth is most common in postmenopausal people over 60. That is because lower estrogen levels cause decreased blood taste buds sensitivity. Your genetic ability to taste also plays a role. This is the reason. Postmenopausal people over 60, that is because lower estrogen level cause decreased taste buds sensitivity. If the estrogen higher, gingivitis may cause. It should be normal. Otherwise, there is decreased taste buds sensitivity. Your genetic ability to taste plays a role. Now, different types of tongues. Again and again, we can see blood and deficiency with heat, blood and deficiency with heart, heat, stomach deficiency with a damp heat. There are heat from different parts. Indeficiency, this may be a Japanese classification, with excess heat, reddish. Stomach indeficiency with a damp heat. blood with fluid deficiency with heart heat. There are different types of heats are there. Blood deficiency with heat. Stagnation, such deficiencies. Stagnation turning into heat. Stagnation, blood stagnation with heat. Watch for a little while. Appetite. Hormones that control appetite. Cholecystokinin, glucagon-like peptides, and neuropeptides are hormones that control appetite. What is the role of metabolic hormones in taste buds of tongue? Abstract. Gustation is one of the important chemical cells that guides the organism to identify nutrition while avoiding toxics. These are the hormones. We already said that. Some hormones produced by taste buds, it may affect. Secrets. Fissures, abnormal smoothness, thick yellow coating, painless bumps, white creamy layer patches, bright redness, black and hairy. Sores, mouth sores. The secrets your tongue reveals about your health. So now, from now, we have to study each and every tongue of a person. Whoever coming with us, to us, whatever may be the case, we have to keep. Premenopausal syndrome, which hormone present in the tongue produce locally taste buds and heat. Blood and deficiency, I told these are blood stagnation. Can hormones affect tongue? Like now, these are the things. Now I think that the time is over. Crosstalk between hormones and oral health in the midlife of human. Conclusion. Hormone influence our oral health by directly affecting the oral tissues as well as affecting tissues as well as affecting the multitude of organs. Those mapped tongues. These are the areas. Connection, tongue with different parts of our body. Okay, I think that now it is enough for today. Now, that's only the females. Okay, thank you very much. I told many medicines. You doctors are always treating cases. You know that these are the medicines. You know everything more than me. So I'm humbly saying that many doctors, while they are taking classes, I may feel that I am very much back in Materia Medica. So thank you all.
Thank you, Dr. Hibbert, for such a beautiful session in this evening, even though you just arrived as a stopgap presenter, but instead you have shown the beauty of your presentation, and you know much about these things because you are a person always dedicated in studying all these separate this thing in details. That's why you are able to produce such a brilliant session about endocrinology and its homeopathy, diseases of endocrinology, and how to manage it with homeopathy. Yes, tongue is one of the most important area where one can definitely find the medicines also. If a person not looking at the tongue, you may not be a right doctor as far as a homeopathic doctor, because just while opening the mouth of the patient itself, you can find there are differences in the shape of the tongue, the activities of tongue, and even the smell that is coming from the mouth. Everything is different. So according to that, we can choose the right remedy. Even though the symptoms, whatever be the disease, whether it be in a cancer, whether it be in an inflammation, or whether it be some etiological unknown disease of an unknown etiology, whatever may be. But anyway, it's the time for discussion. Those who want to participate in discussion may please raise their hands so that we can have a discussion in a good way. If you have a doubt also, you can ask questions because Dr. Hibbert is a well-studied person in anatomy as well as pathology and physiology. Yes. Nobody is having any doubt?
Palmistry is another thing,
Yes, yes.
another area for to study.
Yes, definitely we can take a detailed session on that later. Uh, uh, do you remember any particular case where you are able to prescribe only on looking at the tongue?
Yeah.
You can give a little narration on that.
Normally, these are the medicines, not Nexomica, the main medicine, Nexomica and Chamomilla, and improved. These are three medicines I used it many times. Because the neural supply is in of the tongue is great. So we can make immediate effect with homeopathic medicines. That is, these are some of the medicines which are using very belladonna and other medicines. While we are putting in the tongue, a few drops may immediately make give good result.
Yes, our guest of the next session, Dr. Sunilaj is always here, and so I was watching your presentation. Please make your comments, sir.
Very good, very nice presentation. So what about lactases in this cases, climatic ailments cases? Do you
Yeah,
got
it is
any
good.
lactases?
Yeah, it is very nice. For lacosis cases, for menopausal syndrome and burning, and I told that these are the symptoms in the menopausal complaints we can give. It will give a wonderful result. Within 1 week, we can get a good result from them. They say that the symptoms all are vanished. So good. That was a very nice thing. So I used many times because always we will use these are the two medicines we are very often we use in climatic ages in the menopausal syndrome because before the menopause, 3 years before and after menopause,
yes,
sleeplessness and all these complaints because of burning and flushes of our medicine says that lacosis and graphaitis are the two medicines which are normally, I think that all doctors are using that medicine. It will give some relief for that patient. Thank you. Ram,
Yes, Dr. Ambrose, sir.
Thank you, Dr. Dhanesh, and congratulations, Dr. Hubert Disalvaji. Very nice presentation, excellent session. Map of tongue and symptom, cause and effect. But electrical disbalance after chemical disturbance is called name of hormonal disturbance. Effect mechanical mechanical, yani tongue and body, liver, etc. So tongue is a very important in the body. So very nice presentation, excellent session. Very, very thanks, Doctor.
Thank you, sir.
Thank
Thank you, sir. Like an very, from your part, you are always giving us some tips of the treatment and medicines which are very useful for us because of your vast experience. I think that is, how many years having you have experience, sir? How many years? 40?
30 years experience.
30, only 30.
30 years experience in homeopathic field. Oh,
And now I invite Dr. Boglin to say a few words, as well as Dr. Bob can say vote of thanks at the end also.
Thank you, Dr. Danesh. Today is a good opportune time that I managed to follow Dr. Hubert all the way from Borneo, Malaysia. And it has been a very fruitful session tonight. And Dr. Hubert has explained very detailed about the tongue, the physiology, paraphysiology, and the pathophysiology, and how it related to the treatment of the individual by looking at the tongue. And I think he has a lot to share with us. And I think 1 hour is not enough. Maybe we should invite him later for another session. And on behalf of the IFPH, I would like to express my sincere thanks to Dr. Hubert for a very, very good presentation tonight. And thank you once again. Over to you, Dr. Danesh.
Thank you, sir.
thank you. Very nice.
Thank you, Dr. Boglin. Dr. Bob is always here to moderate, as well as to make comments, as well as he's a person always coming here for saying vote of thanks. He's always asking questions, and such a person, nice person. We are very happy to have such persons in the forum. He is one of our chief coordinator at Malaysia. Thank you, Dr. Boglin.
Thank you, thank you.
So with that, we come to the end of the day, 1648. Tomorrow, we will have a session from Dr. Rashmi Shukla, and she will be talking about concept of cure, the gray line between curable and incurable diseases in homeopathy and its modern perspective. Thank you all for joining this session. Thank you, Dr. Hibbert, once again for such a brilliant session in this evening. Thank you all.
Thank you.
Good night.
Thank you
It's
all.
over to Dr. Mariamma John to moderate the Malayalam session.
Thank you. Thank you.
Nandini Dhanesh Doctor.